The opposition is raising concerns about a $422 million proposal for an emergency vaccine communication campaign. The health minister was questioned by journalists on Thursday on the proposal and defended the move, but the opposition is insisting the money should be spent elsewhere. Here's Giovanni Dennis with this report.
A year-long emergency vaccine communication campaign proposal set to cost taxpayers $422 million. Here's the health minister on Thursday explaining the importance of countering anti-vaccine sentiments.
Sometimes we don't give sufficient value to the need to manage public perception. I will say, in support of my core discipline, that if perception runs counter to what you want persons to do, then no matter how real the reality is, you're likely not to get them to do it. It really starts with a belief, and we have to create that belief, and it has to be grounded in something.
There's been public concerns about the proposed budget and the necessity of such a campaign. Now, the opposition is raising similar concerns.
That $400 million could have been better spent. There are many entities that provide service to hospitals which have outstanding bills for months. I've been getting calls from suppliers who have not been paid for some time. We have doctors who are waiting to be employed. Even before that, we have JIS, Jamaica Information Service, which is allowed free airtime based on the contracts of all stations in this country. And I think it would have been better, GIS, being given the carriage.
But Permanent Secretary in the Health Ministry, Dunstan Bryan, is defending the move.
It's a behavior change campaign. We are trying to change people's perceptions. We are trying to change people's behavior around vaccination. And we are trying to achieve a certain percentage of the population vaccinated. Based on the surveys that have been done, there's a lot of myths and misinformation around the vaccines that you will have to counter with a communication campaign.
He also explained why the Jamaica Information Service was not chosen.
GIS does all the placement for the Ministry of Health. We pay GIS to make the placement. So if I'm making a placement on your station, TVJ, and I need to make the placement where I know I'm going to get the widest possible viewership, when would I make that placement? During primetime news. GIS doesn't have free spots during your primetime news, so we'd have to pay for those spots.
But the opposition is raising yet another concern, the selection of one integrated group, a company incorporated in 2018 for an emergency contract.
What I'd like to know is on what basis this particular firm was selected, because as we were told that it did not go to the tendering program, it's an emergency procurement. And secondly, my understanding, unless I get further particulars, that this PR firm was established in 2018. What is their track record in doing this type of promotion?
Because they're the same company who did the campaign for Christmas. Given that they had done that campaign and they were already au fait with all of the different parameters for implementation for COVID, then it made sense for us to do a continuation of their contract for the vaccine campaign.
Giovanni Dennis, TVJ News.